Hello, my name is Shay Atzmon. I have a bachelor's degree in physical education, specializing in sport with physical disabilities. For the past 20 years, I've been working with Parkinson's patients, especially at the homes, knowing that physical activity on a regular basis can slow down the deterioration of the symptoms and maximize the positive effects of medication. All of the exercises presented here are a part of a standard care I use as an expert in training these patients. So let's begin. Safety instructions and guidelines for physical activity with the Parkinson's patients. Number 1. Starting physical activity with Parkinson's patients must be accompanied by a doctor's examination and his recommendation for the type and nature of the activity. Before we start practicing, it's recommended to update your physician about the nature of the exercises you're about to do. Number 2. Choose a training time that optimally suits you. Number 3. Rest before you start practicing and make sure that the level of symptoms is balanced by medication. Number 4. Practice must be done in a safe environment, free of obstacles. Use stable objects that cannot move while exercising, a table or wall. Number 5. If you feel any pain or difficulty during the activity, you must stop practicing immediately and consult your physician, physiotherapist, or qualified trainer. Sitting exercises to strengthen the back and shoulder muscles for people with Parkinson. As part of training routine, it is recommended to add strength exercises for the back and shoulder muscles at least 3 times a week. Notice: take at least 48 hours rest between the exercises while working on the same muscle groups. When you perform muscle strengthening exercises, breathe out through the mouth when the muscles are under tension and breathe in through the nose while releasing them. This is a high-level exercise which requires close supervision of a qualified physiotherapist or trainer. And now let's begin with the exercises that I gathered while developing my unique training framework. Number 1. Shoulder abduction. Sit upright on a chair without handles. Hold with both hands soft power balls by the sides of the body. Lift your arms sideways to a 90 degrees position. Repeat 10 times. Number 2. Shoulder flexion. Hold with both hands soft power balls by the sides of the body. Lift your arms up above your head. Switch hands and repeat 20 times. Number 3. Shoulder horizontal abduction. Lift your arms forward and place them directly at shoulder height, palms facing each other. Move your hands at the same time to the sides of your body. Hold for a count of 3 to 5 seconds. Repeat 10 times. Number 4. Resistance band seated row. Sit on a chair without handles. Make sure to keep your back straight and do not lean back on the chair. The trainer sits in front of the trainee about 2 meters away. The trainer holds his resistance band by his hands, while the trainee holds the handles, palms facing each other. Pull the band toward your waistline while squeezing the shoulder blades. Slowly release tension to return to the starting position. Repeat 10 times. Number 5. Resistant band pull apart. This exercise is ideal for strengthening the rear shoulders and upper back, helping to prevent rounded shoulders and kyphotic posture for Parkinson's patients. Based on the previous exercise, the trainer holds his resistance band with his hands, while the trainee holds the handles, palms facing each other. Extend your arms straight out. Lengthen your spine and keep your elbows slightly bent. Stretch the band as much as you can, draw your shoulders blades together. Hold this position for 3 seconds. Return slowly to the starting position. Repeat 10 times. Number 6. Strengthening sitting, elbow flexion with soft power balls. Sit on a chair with your back straight. Do not lean back, and arms stretched down. Bend your elbows. Move your hands towards your shoulders while exhaling. Straighten your elbows and slowly lower your hands to the sides of your body while inhaling. Repeat 10 times, 2 sets. Take a minute rest between the sets. Number 7. Chest press. Hold the ring in front of you with your hands at shoulder height. Place your palms on the padded side, fingers bent on it. Keep your elbows slightly bent as if you are hugging a ball, and press down the ring. Try to create an oval shape while using your chest muscles.